many patient is daily basis reported in clinical practice and ask this question: how do you assess whether patient needs surgery of alternative treatments could be more effective?
Actually, talking about surgery, when tell a patient that the patient will need surgery, this creates a panic in a person. And nobody wants to go to the operation theater and lie down in the bed and submit himself or herself into a hand of a surgeon. Same is the case with me, and I'm sure Professor Majid Chaudhary, he is also scared to get into a surgical process.
Sir.
So everybody wants, when you talk about surgery for his mode of treatment, everybody wants that how can I avoid surgery? Can you give me anything else other than doing surgery? I'm ready to do anything. I'm ready to spend any amount of money,
Sir.
but I don't want to go into surgery. This is what Professor Majid was telling, that pre-operatively, post-operatively, you have to communicate with the patient properly.
Sir.
This is something lacking in this part of the world, that we do not communicate properly, so the patients do not get the actual picture.
Sir.
We have to tell people that the operative technique which is going to be done for you
Sir.
is the best possible treatment that can be done and that is available in the world.
Sir.
Number two, nothing is complication free.
Sir.
Even the medicine has its own complications.
Sir.
There are side effects of drugs.
Yes.
So we expect that if you can do it properly, have a good pre-operative measure,
Sir.
and operate properly, give a post-operative care
Sir.
properly, I'm sure you will not have any problem. You will be cured with the surgery. So
Sir.
better you go with the surgery. And I feel in my private practice, I have seen that many patients wanted medical treatment, refusing surgical treatment. When we communicate them properly, we make them understand,
Sir.
they submit to the surgical process. This
Sir.
is what my experience is.
Sir, what advice do you have for patient considering elective surgeries?
Elective surgeries. Elective surgeries basically are the surgeries which take place due to some chronic disease,
Sir.
which does not require immediate surgery.
Sir.
So we feel that elective surgeries have much better outcome than
Sir.
emergency surgery.
Sir.
The reason being, when you do an emergency surgery, we do not have much time to prepare the patient
Sir.
preoperatively.
Sir.
So they may undergo a lot of surgical complications.
Sir.
We do not know the extent of the disease because
Sir.
we had no time to do all these and
Sir.
submit to the surgical process. This is an emergency case,
Sir.
which you have got to do it immediately.
Sir.
As regards to elective surgery, you have enough time.
Sir.
You can do proper investigations. You
Sir.
look at the morbidities. Say patient has diabetes, patient has heart disease,
Sir.
patient has respiratory disorder. You can find them out
Sir.
and give appropriate treatment and then submit to the surgical process,
Sir.
which obviously reduces the post-operative complications,
Sir.
any sort of morbidity,
Sir.
and any sort of mortality of the patient in the post-operative period.
Sir.
And the outcome is excellent in elective surgery compared to emergency surgeries.